5-minute video. This is Dr. Pepe going over the National Counseling Examination. We are under Domain 2, Intake Assessment and Diagnosis, and today we're going to be covering Subcategory I, determining the appropriate modality for treatment. So as you have studied in theories class, there are various modalities. A modality is a category of therapy that involves certain techniques, and these modalities, based on a theoretical framework, will guide the counselor in the therapeutic process. There are many types of counseling modalities. I will go through the major ones. So psychoanalytic, that is associated with the psychodynamic, and that's associated with Sigmund Freud and Alfred Adler, talking about the unconscious, dream analysis. And the psychodynamic has been modified to more modern terms. The next category that you should be familiar with are the behavior or behavior-based modalities. This is the founders or the father of the behaviorist is B.F. Skinner. But you should also be familiar with like John Watson, and they stress measurable behaviors that can be quantified. So, Dr. Skinner, he was very quantitative based. He said, if I can't see the behavior, then I'm not interested in it. And he stressed that psychology should be considered a hard science. The next field that you should be familiar with is the cognitive. So this is the cognitive behavior therapy. Dr. Beck comes to mind. This modality focuses on the connection between your thoughts and your behaviors. So you may see like the ABC, the antecedent, the behavior, and the consequence. With a cognitive modality, you are looking at how thoughts, patterns, beliefs then impact the behavior. The next modality that you should be familiar with and understand is the humanistic. And with the humanistic, uh, um, um, you know, the person-centered, or I think of Carl Rogers, or I think of Viktor Frankl. These modalities state that humans have the potential and they're looking for meaning, and you as a counselor are that facilitator uh, of exposing that potential and creating that meaning so that they understand the direction that they are headed to. So for humanistic, a technique could be to look at traumatic events and then making sense of that suffering and using that as a motivator, or as something that the client creates meaning, and it motivates them to continue with their journey. And finally, the modality that you should also be is the integrative or the eclectic. And this is where you're combining two different modalities, or you're using two different orientations in order to guide your focus. So again, you have the psychodynamic, the behavioral, the cognitive, and the humanistic as some of the main modalities in counseling.